Coming out of Husson's physical therapy program, they prepare you to be a generalist physical therapist, which means you have a broad spectrum of information that you are educated in so that you can work in various different fields.
I chose Husson because of the program itself. The 3+3 program was really attractive to me for the sense that it was really going to get me into the hands-on PT-related learning fairly quickly.
A lot of people think that physical therapists just do exercises and that we just sit there and prescribe exercises, but it's a lot more than that as well.
Physical therapy is a treatment of somebody that has a functional limitation that is limiting them from doing something that they love to do.
Initially, we do just an evaluation, a general evaluation, and then from there we gather all this information that we put together to find a prognosis, a diagnosis. What are we going to do with this patient and what do they need from us?
The professors are amazing. They're all extremely helpful. They're willing to go out of their way to really make sure you understand what you're doing and really get you to enjoy what you're learning.
They're caring. They're not only there to teach, but they're there to be your friends, they're your mentors, and they really care about you outside of school.
One of the interesting things that we have here at Husson in the DPT program is a cadaver lab. We get to go in our first year of grad school for a gross anatomy class. Then we go in our final year for some more advanced dissection.
So the hands-on nature of the labs is really helpful because it's solidifying the information that we're getting from the lectures into our real-life situations with patients.
One of the ways that the students are able to give back to the surrounding community is through a student-run pro bono clinic where we work interprofessionally to provide for the underserved of the Bangor area.
One of the greatest attributes Husson has is they send us out into clinical rotations. So when I was there, we went out into 4 clinical rotations where we worked with actual professional physical therapists and worked with real-life patients, creating treatment plans in order to get them better and get them back to their daily living.
The clinical experiences that we've been able to have, those opportunities have been enormous growth times for everyone in our class.
We go out into the clinic, work with the patients at that clinic. It's really a lot of fun. I think it's the best way to learn here, and I think that's one of the best things that Husson has for us is those clinicals.
They've prepared us really well, and I think everyone in our class has grown enormously through those periods of learning and getting some really good hands-on experience. So I'm really excited just to get out and start doing what I want to do.
Everyone here is pretty close-knit, especially in my class. We spend a lot of time together outside of school, spend a lot of time together studying.
There are a lot of people that I really plan on keeping in contact with throughout the rest of my life that I've met here, and it's been a really great experience.
I would suggest Husson University's physical therapy program because of the nature of the program itself. Being really hands-on, it really makes interesting learning, fun, and engaging.
I got into this field because I love being able to work with people, taking someone that's in pain and not being able to do what they love to do and treating them, getting them pain-free and back to everything that they love.
I realize this is exactly what I want to do. I'm out there helping people. You're not just a physical therapist, you're not just working on them, but you're forming relationships with your patients.
No, I'm really excited to get out into the real world, to get into the physical therapy profession and help other people get back to where they were before and really improve themselves overall.
After attending Husson for 6 years and graduating with my doctorate of physical therapy and now having 2 private outpatient clinics, being able to give back to the community and helping patients live a healthier, happier life has been very rewarding.
I wanted to learn things well, and I knew that coming to Husson, it was a small school and that I would get the attention that I needed from the teachers to make me the best clinician I possibly could be.